Recapping Dissection 12 from September 20th Roast Lab. So this lab was all about the spatial relationships of abdominal viscera. And so what we saw were we have some organs that are specifically tacked onto the left side of the body wall and right side of the body wall. And so for the left side, we're going to mostly see our stomach, our spleen, and our descending colon, whereas on the right side we have a whole bunch: the liver, the pancreas, the ascending colon, the descending duodenum, the cecum, and the gallbladder. So let's orient ourselves with this picture first. So on the right side, we have the big liver, and that is your most cranial organ. Sitting underneath that and to the left will be your stomach. Now, the stomach can be divided into a whole bunch of sections. If this is our esophagus and this is our duodenum, the esophagus drains into the cardiac part of the stomach, or the cardia. To the left and dorsal to that is our fundus, this big kind of bubbly outside over here. We go around the greater curvature of the stomach and we're in the body. And we have the lesser curvature on this side. We'll eventually start reaching the pyloric part, where we go through pyloric antrum, pyloric canal, and then we'll go through the sphincter, the valve, and that is the pylorus itself. The pylorus is the valve, not the actual part of the stomach. So we call this as a whole the pyloric part, not the pylorus. And then we're going to go into our small intestine through the duodenum. Now, the duodenum has several parts as well. We have, as the pyloric canal drains into the descending duodenum, we're going to go through the cranial duodenic flexure, just kind of the bend in the intestine. And then we'll go down the descending duodenum, go through our caudal duodenic flexure, and become ascending duodenum. And then we'll go and enter into the jejunum, the next section of the small intestine. And again, the descending duodenum is our most lateral and a bit more dorsal organ once we get into this midgut area. It's going to be lateral and dorsal relative to your ascending colon. I digress. The jejunum will be all that mess of crazy noodles you have in your stomach until you hit the ileum, which leads into the large intestine. Now, the ileum is kind of really hard to distinguish from the jejunum. The easiest way to go about it is to first find your cecum at the junction between the ileum and the large intestine. The cecum is kind of this outpocketing of tissue that you expect to see on the right side of the body wall. And if you go towards the small intestine, once you find the cecum, you're going to be in ileum for some distance, and then you'll hit jejunum again. As far as how to really recognize the ileum, unless you're looking at the lumen, which has this very kind of like squishy, puckered appearance, whereas the jejunum has a much more like rounded lumen. The only real way to tell from an external point of view is to look for an artery, the antimesenteric artery, which is a artery that runs on just the ileum, and you won't see it once you start hitting jejunum, and it is on the side opposite the connective tissue that attaches the ileum to the dorsal wall. Now, in fat animals, it's very hard to see that artery, so again, this is kind of more of a appreciate that it's there than actually recognize it's there kind of piece of anatomy. I digress. As we move past the cecum, past the ileum, we're in our ascending colon, another right-sided organ. Then we will go through our right colon flexure, our right colic flexure, and become transverse colon, which runs just caudal to our stomach. Then we'll go through our left colic flexure and enter the descending colon, a left-sided organ that eventually becomes more medial and runs out the anal canal through the rectum. So rectum, then anal canal, and we make happy boobs. Okay? And other organs that are worth mentioning, the gallbladder we know is a specifically right organ, but it's much harder to see from an external point of view. Rather, you kind of have to go up and or under and look up through the liver to find the gallbladder. The gallbladder will be sitting around here. It's a little bubble, and yeah, for now, that's all we care about. The spleen is much more noticeable, although its size seems to vary no matter which source I use. So in the cadaver I dissected, the spleen was only about yay big. We could see it extend from the left side of the body out about yay far, and then it wrapped around the lateral side of the body. The most important thing to know about the spleen, though, is that it should be palpable because it's very superficial. You should be able to feel it just under the ribs. It will extend a bit further cranial underneath the rib cage, but by and large you should be able to palpate it on your left side. Okay. Now in other animals, I've seen the spleen go quite a bit ways over, and it's reasonably large, and you'll see it extend even to the right side. But it's definitely the main body of the spleen is focused on the left side of the abdominal cavity. You'll also see it sometimes extend a bit caudally as well, but again, main area should be here. And as far as what keeps it in place, we're going to have the splenic what is it? The gastrosplenic. The gastrosplenic ligament. And the gastrosplenic ligament is just a ligament that attaches the stomach to the spleen, as the name suggests. Other connections, we have the greater and lesser omentum. So the way you can, so the lesser omentum you're going to find on the lesser curvature of the stomach. And that's going to be essentially connecting stomach to pancreas to, I believe spleen as well. No, never mind. I digress. Whatever. The lesser omentum will be on the lesser curvature of the stomach. The greater omentum, however, is more of interest, and you'll see it as soon as you open up the body cavity. Basically, it's this kind of bib that starts from the greater curvature of the stomach and kind of just covers most of our viscera. The things that it doesn't cover: kidneys, it doesn't cover bladder, it doesn't cover part of our descending colon. And this sheet is going to have two halves, basically. It's going to have the superficial leaf of the greater omentum and the deep leaf of the greater omentum. And in between them, there's going to be a pocket called the omental bursa. For the deep leaf, this is where you're going to find part of your pancreas. The pancreas is kind of, there are two lobes of the pancreas. One that kind of extends along the length of the stomach, and one that extends more caudally along the length of the duodenum, around the curvature of that cranial duodenic flexure. The one that is in the cranial duodenic flexure is going to be kind of entrapped in mesentery, and that's going to be mesoduodenum. The part that is running to the right, or underneath the stomach, that will be in the deep leaf of the greater mesentery, or greater omentum, sorry. As far as the spleen is concerned, the spleen is in the superficial leaf of the omentum, although it's sometimes hard to see because it kind of attaches and wraps around it deeper, and this part that sticks out is less covered by it. Long story short, those are the main ideas. I think that's about it for this one. So there we go. Dissection 12 recap.